Christina Marriott is the Chief Executive of the Royal Society of Public Health. She's on the line. Good morning. Christina, can I get a first reaction from you?
Well, I think the announcement probably raises more questions than it's answered, and I think we do have to question whether that's sensible in the middle of a pandemic. So a key question for us is, what do these proposals mean for the breadth of public health work, including that on prevention and health inequalities? So the work on alcohol, smoking, physical activity, obesity, all the things that we know have been really important in COVID and our high mortality rate under COVID, but which every year account for 40% of our premature deaths. I think, secondly, my reaction is, I wonder what this is doing to the staff and how they respond. I wonder if we are in danger of losing really good staff just when we need them most. But I think my biggest concern is that this decision has been made ahead of the inquiry that the Prime Minister has promised us into what has gone so badly wrong with England's response to COVID. And without that inquiry, in a complex system like pandemic response, we cannot learn the lessons that will allow us to protect the public's health better in any future wave. So just abolishing or amalgamating or merging one organisation doesn't address the multiple failings across different organisations that led to our incredibly high mortality rate, the highest in Western Europe.
There's not a whole lot of detail about what happens to the rest of PHE's responsibilities. The Department of Health press release says that the Department of Health and PHE experts will engage on future options on decisions around the remaining health improvement functions. I suppose there is an argument, though, isn't there, to say that you've now got these different bodies. You've got the test and trace body, you've got the Joint Biosecurity Centre, bringing PHE's functions together with those other functions will give a sharper focus to this very pressing need to deal with coronavirus and any other external threats.
There may be an argument for bringing that focus together. To be honest, it reverses the Lansley report, the Lansley reform in the Health and Social Care Act of 2012. Before that, we had the Health Protection Agency, very much focused on health protection. Again, I would question whether this responds to all of the problems we've had in our COVID response. So we've had problems around the timing of lockdown. We've had problems around messaging. We've had problems around our testing capacity. We've had problems actually very much in that track and trace system that is branded as the NHS but is actually Serco is still massively underperforming. It is not as effective as it should be. So it would strike me that you would rather sort those problems out before going into a system reorganisation. We need to learn is to fund public health well, because between 2015-16 and today, public health in real terms lost 800 million in annual budgets, 22%. And you can't do world-beating pandemic responses when you just don't have the budget, and you don't find out about your budget until 2 weeks before the end of the financial year, which is what happened to public health this year. So the government should more be concentrating on establishing under the spending review a substantial medium-term settlement for all of public health and allowing it to do its job.
Christina Marriott, thank you. Christina Marriott from the Royal Society of Public Health. I'm joined by